Many Americans heading to the beach this holiday weekend will bring along their sunscreen to help prevent skin cancer. It's the most common type of cancer. 3.5 million Americans will become victims this year, but you may not realize that several sunscreen formulas are off limits here in the U.S. Dr. Holly Phillips is here to show us why. Good morning.
Good morning, Margaret.
I'm one of those people who buys all sorts of sunscreen here.
Sure.
I have to, but does this mean as an American I'm not actually getting the best product to protect me?
Well, you know what? The FDA has not approved a new sunscreen active ingredient for widespread over-the-counter use in 15 years. Now, medicine, just like technology, is always evolving. So can you imagine using a 15-year-old computer or a 15-year-old cell phone? That's how far we've come in terms of changing the way we think about sunscreen products. And there have been a couple of reasons for this. Number one, Europe has many more products available to them, but they classify sunscreen as a cosmetic, whereas here we classify it as an over-the-counter drug. So there's much more stringent regulation, of course, around drugs than cosmetics.
Which explains the delay. I mean, the FDA is saying the approval process for over-the-counter drugs is outdated and doesn't work. So what, if anything, is being done about it?
You know what? There's been a huge amount of lobbying of lawmakers, both by dermatologists, sunscreen manufacturers, skin cancer organizations. And actually, Congress has proposed something called the Sunscreen Innovation Act to help the FDA kind of streamline this process. Absolutely. I mean, but when you think 8 products that are widely used in Europe, even Canada, other places, they've been waiting FDA approval for 10 years. Wow. It's a pretty long time.
So what is different about some of these European sunscreens that makes them maybe better?
Right. Well, Margaret, you know, now we know so much more about skin cancer and sun exposure than we did 15 years ago when the last products were approved. It's right now there's a huge focus on UVA rays. UVB rays cause sunburn, but UVA rays penetrate more deeply and are also linked with skin cancer. So here we have a few products. There's look for active ingredients called avobenzone, titanium dioxide, zinc oxide. Those protect you against UVA rays, but in Europe they just have many more options. And since some of us are sensitive to certain products, it's better for more options to be out there.
But there are things that we have here that we can use. It's just
Absolutely.
we don't have the selection.
Yep.
All right, Holly, thanks.